PM to say a few words.
Thank you very much, Pang, and all the AMSA members who have made a lot of effort communicating with Dwarka and having this session. We have had before a lot of session on the UK exams and US MLE exams. Australia exams, I think the last one we had was long time back when a member of batch 16 who came and gave a talk. That was pretty long time back. And there were a lot of interested students who wanted to know how the pathway to Australia works. And we have a very dynamic alumni of ours who is going to come and tell us the story of her journey. And she is right now in Australia as well. So I would like to thank Wenhao and team from AMSA MUCM for conducting this. And a special well done for Trisha, who's the organizing chair for this event, and all the role players that has helped her in this process. And they also had a dry run to make sure that there are no glitches, but of course online. So we all hope to have a wonderful session ahead. And back to you, Pang.
All right, thank you, Professor. Next up on our agenda is a photography session with our speaker. So may I have all the participants and committee to turn on your cameras and put on your best smile if you'd like to join us in this photography session. We'll give you about 10 seconds to get ready to turn on your cameras.
Hello, Kanchana. Guys, please on your camera. It's just only for the photography. After that, you can off it and relax and things like that. Just for this photography to make it something that we want to immortalize. This is not a lecture class, so you don't have to like have attendance kind of thing. Right. So who's taking the picture, Pang?
All right, Wei Mei, could you help to take a photo?
Yeah, sure. 1, 2, 3. Again, 1, 2, 3. Okay.
All right, thank you for your cooperation. Now it is with pleasure that I introduce our speaker for today, Dr. Dwaraka Jayakumar. Dr. Dwaraka is our very own alumni from batch 25. Dr. Dwaraka is currently working as the GP registrar at the private practice in Sydney, and she has trained as a medical intern in the teaching hospital Betty Kelua, Sri Lanka, and she was the resident medical officer in the Bundaberg-based hospital, Queensland, Australia, also in the Hawkesbury District Health Service, New South Wales, and she is the GP registrar under Royal Australian College of General Practitioners. Now, without further ado, I'll pass the floor to Dr. Dwaraka to begin this session. Over to you, Doctor.
Thank you. So thank you for having me today and for an excellent introduction. Good evening, everyone. So let me share my slides first. Am I audible? Yeah, okay. So so I'm here today to talk about working as a doctor in Australia. So I'll go through my presentation first and then open up for the questions at the end. So today I'm going to cover like briefly about the Australian healthcare system, and then a pathway to medical registration in Australia, and also about finding a medical job in Australia. And at last, I'll talk about my journey of AMC registration. Then I'll try to answer your questions at best. So, so first we'll look briefly into Australian healthcare system. So Australia is a federation of 6 states and 2 territories. It has 3 different time zones, 25 million population, which is less than Malaysian population, and we have a ratio of 3.5 doctors per 1,000 people. We have 6 states in Australia: New South Wales, Queensland, South Australia, Tasmania, Victoria, Western Australia. And Sydney is the capital city of New South Wales. Melbourne is the capital city of Victoria. We have 2 territories here: Australian Capital Territory, that is Canberra, and Northern Territory, that is Darwin. We have 3 different time zones here. So Australian Eastern Standard Time, that is 2 hours ahead from Malaysian time. Central Standard Time, that is 1.5 hours ahead of Malaysian time. And Australian Western Standard Time, that is same as Malaysian time. So this is the flow chart for Australian healthcare system. So this diagram explains the healthcare system of Australia. So Australian government regulates the healthcare system in Australia. So the Australian government is made up of state government and federal government. Each state and territories has a state government. State government runs public hospitals in each state. Public hospital medical service is free for citizens and permanent residents of Australia. I started my career in public hospital in Queensland as a Queensland government employee. Then we have a federal government which manages Medicare Australia. Medicare is Australia's universal health insurance scheme, which provides a range of medical services and lower cost prescription and also free care in private services. So PBS is a pharmaceutical benefit scheme that that subsidize prescription medication. So next we'll go through the most important part of today's presentation, that is pathway to medical registration in Australia. So there are 4 pathways for a medical registration for IMGs in Australia. So I'll be using this term IMG quite frequently today. So IMG is International Medical Graduates. So people who graduated outside Australia will fall into this category. So the first pathway is a competent authority pathway. We are not going to look at this pathway in detail because Malaysia is not listed in competent authority pathway. Medical councils of the doctors who are registered in medical councils of United Kingdom, Canada, USA, New Zealand, and Ireland approved for competent authority pathway. And the benefit of this pathway is you don't need AMC exams to work in Australia. The second pathway is standard pathway. So we will go into detail about this pathway in coming slides because this is the pathway that most of you all will be following. Third is the specialist pathway. So this pathway is for specialists. Again, I'm not going to cover it in detail, but IMGs should contact the relevant Australian specialist medical college in Australia because the eligibility varies between specialty to specialty and country to country. So if you're not interested, then it's better if you'll contact that specific college. The fourth type is short-term training in a medical specialty pathway. This is basically for the IMGs who are overseas trained specialists or specialists in training wishing to undertake a short period of specialist or advanced training in Australia. So standard pathway. So there are 2 types of standard pathway. So this is the pathway that most of you all will be going through. So first type is standard pathway with AMC exams. So this consists of AMC CAT MCQ exams and also AMC clinical exams. As I told you before, most applicants are assessed through this method. Second is standard pathway with work-based assessment. This consists of AMC CAT MCQ exam and work-based assessment as an alternative for AMC clinical exam. So here they will assess our clinical skill and knowledge through the workplace. And there are only limited providers available through this pathway only 11 locations are there in Australia. So this is very hard to get into this pathway. So next we'll look how to apply for AMC, that's the Australian Medical Council. So IMGs must have their primary medical qualification recognized by Australian Medical Council. So Australian Medical Council recognizes MMMC degree. And so if you want to like apply for AMC before your graduation ceremony, you can apply with bona fide certificate from the university. That's acceptable. The second step is creating an EPIC account to confirm your identity. So EPIC account is electronic portfolio of international credentials. So you can apply through online, and then you will get a EPIC ID confirmed within 2 to 3 working days. This will cost you around $130. The third step is establishing an AMC portfolio for processing by AMC. So this requires an EPIC ID and to complete your portfolio, and you will get a AMC candidate number in around 3 to 5 working days. This will cost you around 500 Australian dollars. Then you will upload all your qualification and required documents to this EPIC account, and for processing by ACFMG, that is Educational Commission for Foreign Medical Graduates. And then all those records will be sent to Australian Medical Council. The qualification will be verified, and the report would be automatically sent to AMC, and that will cost you around $100. So then we can proceed with the standard pathway. It may appear a bit complex, but if you go through the website, it will guide you throughout this process. So now we'll look further detail on standard pathway exams. So this there are two parts of AMC exam. So first part is AMC CAT MCQ exam. So once you have completed the registration process with AMC, you are eligible to sit for AMC CAT MCQ exam. This exam will cost around 2,720 Australian dollars. So AMC part 1 is a computer adaptive test. MCQ is a computer administered, fully integrated multiple choice questions, which is delivered in 3.5 hour session in exam centers worldwide. You can sit for AMC CAT MCQ exam in Singapore. That will be the nearest to Malaysia. And I sat in India, and there are many other countries that provide these exam centers. This exam consists of 150 MCQs, 1 correct response from 5 options. It is focused essentially on medical knowledge involving understanding of the disease process. So this exam has majority of the questions from adult health medicine. That is 30% of the questions, which includes ophthalmology and ENT. And then the second majority of questions will be from adult health surgery. That is, which includes general surgery, orthopedics, urology, and then women's health, that is 12.5%. Again, child's health, mental health, and population health. All around 12.5% of the questions. So altogether, it's 150 questions. So for AMC MCQ exams, there are reference. We have a few books that we can use as reference. First book is John Murtagh General Practice. That book has it's like a theory book which has almost all the important topics with how diagnosis, approaches, investigations, and management, which you can use as a guide while you're preparing for the exams. You don't need to know page to page from that book, but yeah, that's a good to use as a guideline. The second book is a Handbook of MCQs. So this is important because it actually has a few like many MCQ questions, like example questions with answers and discussion. So it is a good idea to start your preparation with this book so that you will get a good idea about the MCQ exam. And then if you need further understanding in a certain topic, then you can refer John Murtagh. There are also few online question banks available, such as AMCQ Bank, Modbed. There are like a lot of other options, which is good for you to practice before the exam. Second part, that is the AMC exam part 2, clinical examination. Once you have completed AMC CAT MCQ exam, you are eligible to sit for clinical exam. That will cost you around 3,500 Australian dollars. You have to travel to Australia for this exam. Exam center is located at National Test Center in Melbourne. Currently, it is held online due to COVID. The AMC clinical examination is an integrated multidisciplinary structured clinical exam. The examination comprises 16 assist stations and 4 rest stations. Most stations are of 10 minutes duration, comprising 2 minutes reading time and 8 minutes assessment time. Candidate will rotate through the series of stations and will undertake a variety of clinical tasks. Stations may use actual patients, stimulated patients, videotaped patients, or other relevant materials such as charts, images, and photographs. Stations will assess clinical skills related to presentation of medical, surgical, women's health, pediatrics, and mental health problems. These will be a variety of setting, including community and hospital. Each station has a single board predominant assessment area. These are history taking, examination, diagnostic formulation, management, counseling, and education. So the reference for AMC Part 2 exams will be AMC Handbook of Clinical Assessment. Again, this has few example questions with discussion, and it will explain to you what they expect from the candidates. Again, it's a good idea to start your preparation from this book. There are also coaching classes available for clinical examination. There are coaching classes available for AMC 1 as well, but I think that is something that you can prepare by yourself. But I would highly recommend coaching classes for AMC clinical examination. And then you have to practice with your study partner a lot for AMC clinical exams, just because you need to be, like you should be able to manage your time very well. That's quite challenging in this exam. So next, we'll look into finding a medical job in Australia. So finding a medical job in Australia is the hardest part of working in Australia. So the prerequisite for applying for jobs here is complete your internship at least minimum of 1 year, and preferably get your medical registration from a country. Local graduates typically fill all interns position available in Australia, so it's impossible for an IMG to find internship in Australia. You can apply for jobs after AKT, after MCQ CAT exams. You don't need AMC Part 2 to apply for jobs, but it's definitely better if you have both. The third thing that you need to have is proof of English language proficiency. That could be IELTS or OET or TOEFL. There are a few other options as well that is mentioned in their website. So there are 2 types of visas that you could use to come here. One is once you receive the job offer, you can get a work visa through your employee and move to work in Australia. The second option will be you migrating to the Australia in skill migration and then apply for jobs from Australia. My personal suggestion will be option 1, unless you have family who is in Australia who can financially support you, or at least who can financially support you from overseas. Apply for jobs in Australia. So as I mentioned before, state government operate public hospitals. So if you remember the flow chart from previous slides, each states run their health system. So you need to apply jobs in each state through their specific application website. So I have attached links that is specific for each state, and you have to lodge your application through these specific websites. Next, I'll talk about medical registration. So there are 3 types of medical registrations. First one is limited registration. So limited registration is available to medical practitioners who are medically qualified from a medical school outside Australia or New Zealand and only completed AMC exam part 1. So so I'll talk about myself a bit later. So then the second type is provisional registration. Provisional registration is available to medical practitioners who have completed AMC exam part 1 and 2, but are required to undertake a period of supervised practice to be eligible for general registration. The third type is the general registration. This is available to medical practitioners who have completed AMC exam part 1 and 2 and also required period of supervised practice. So it is compulsory that you need to have a medical, surgical and emergency term before you apply for general registration. So my journey of AMC registration. So I completed my MBBS degree in MMMC in 2014. And then I'm from Sri Lanka, so I went back to Sri Lanka and I was preparing for Sri Lankan entrance exam, ERPM and AMC 1 simultaneously. I completed AMC part 1 in mid 2015. And then I started my internship in Sri Lanka at the end of 2015. And I completed Sri Lanka internship in 2016, December. I migrated to Australia in January 2017. And I basically applied for like jobs for around 3 to 4 months time to before I find a job. But I kind of applied for like around 150 jobs during that period. I received a job offer in Queensland and gained my medical registration. So I got limited registration that time, if you look here. So that time when I applied for the job, so I was preparing for AMC2 and applying to the job, both I did together. I got the job first before my AMC2 exam. So I was eligible to apply for limited registration that time. And then I completed my part 2 exams and then I got the provisional registration in a couple of months' time. So so that's all about me. So do you have any questions? So that's all. I think I finished pretty early, so I'm happy to answer your questions if you have any.
All right, thank you, Doctor.
Yeah.
All right. Okay, so now we shall move on to the Q&A session. So to all the participants, if you have any questions for our speaker, please feel free to ask, and you can type in the chat box. Yeah, Doctor, we have collected a few questions from the participants beforehand. Yeah, so the first question, how to prepare for the AMC examination?
So yeah, so AMC exam, so there are two parts. So AMC part 1, I would start my preparation. I would suggest you to start your preparation from AMC MCQ handbook. That's the blue color book. Just go through it once so that you will get an idea about how this exam works, what they expect from this exam, what sort of questions you get in this exam, and how to approach the questions. So because almost all the answers will be right. So even like, they will give you many right answers, but you have to choose the best option. And then if you don't understand a topic, if you think you need further explanation about a certain topic, then read in John Murtagh General Practice book. So that is how I prepared for the exam, and yeah, it was quite I think it worked well. And then before the exam, also like buy an online quiz bank and practice questions just to make sure you can finish the exams on time, because managing time can be a little bit challenging. So yeah, so that is how the AMC 1 preparation would be. And then AMC part 2. So for AMC part 2, I would again start with AMC handbook of clinical assessment, so that you will understand the exams. And then, yeah, as I told before, coaching classes helps a lot with clinical examination, just because clinical exam is more about assessing you whether you are a safe doctor to practice in Australia. So they expect you to know a lot of medical, how the Australian health system works. It could be a little hard for us if we don't understand how it works. So unless you have a study partner who went through this course, or who has already done the exam, who has some experience, then you probably can skip from coaching classes. But then if not, yeah, it's important that you join a coaching classes, and then they will train you how you should talk, how to communicate, how to be confident, what sort of questions you will get. Because, for example, you can get a question like, about domestic violence in the question, and you, as an IMG, you won't know what sort of law in Australia, how to report, and how to manage this patient. So so that is something that that's why I'm saying coaching class is important for clinical exams. And practicing with your study partner, doing role play, yeah, that is also important for clinical exams. So did I answer your questions? Yeah, and the time is see, for AMC part 1, around 3 months should be enough to prepare for the exam, like 3 months full time. And yeah, AMC 2, I would say it's almost the same time frame should be enough. Yep.
All right, thank you, Doctor. And the next question is, does Australia provide internship for MUCM graduates?
No, unfortunately, no. So there is no internship available for IMGs, yeah, from any country. So just because the local graduates fill all these intern spots in Australia, even though they don't mention anywhere that you need to have internship to get a job in Australia, it's almost impossible to get an internship spot in Australia. So just forget about that. Yeah, like, unless if you're really lucky, you might get a spot in a real rural hospital. But so far I don't know anyone who got internship here.
right. So is it an internship is necessary to complete the AMC examination?
No, no. So to do the AMC exam, you just need to complete your MBBS degree. That's all. Yeah, that's all you need. So you can do the exams soon after your final year exams.
Doctor, there's some question in the chat box.
Yeah, okay, I'm looking at it now.
Please, okay, I will read it out.
Okay, sure.
The first question is, good evening, doctor. I would like to know about the specialization pathway in Australia. For example, how do we plan if we want to specialize in cardiology? And what are the phases to go through? Thanks in advance, doctor.
Okay, so so I suppose you are talking about coming here as a resident and starting like getting into a specialization. So see, the process for specialization will be almost the same for locals and IMGA. So once you are in the once you receive the general registration and when you have the PR, you can apply for the specialist pathway. And it so internal medicine, cardiologists, I'm not very familiar with the specialist pathways just because I didn't get into them, but from as far as I know, it can be a long-term process. It can take around 5 to 6 years, and it is very competitive. So you'll be competing with the local graduates, and yeah. So that's how it works, and it is. It's possible. Like I think, like internal medicine, pediatrics, psychiatry, and emergency medicine, I have seen a lot of IMGs working as a specialist here. So those are the areas that are quite relatively easy to get into. But again, yeah, always specialist pathway could be a little challenging. Yeah. So
The next question is, can you be medically registered in 2 different countries to practice medicine?
yeah, I mean, yeah, so you need to be registered in like the country you want to practice medicine. So you can, so I am registered in Australia and Sri Lanka, and I'm practicing in Sri Lanka, sorry, in Australia now. So it doesn't really matter as long as you have a registration in one, like wherever you want to practice. So yeah, it's good to have another country registration just because in case if you're finding it hard to get a job here, you can go back and work in the other countries. So yeah.
There's a question asking about the working environment, the expenses, and also the salaries in Australia.
Yeah, so working environment is good. I have no complaints. I think we have a good, work-life balance here. We work for like, this many hours, and then we can, have spend our time with our family. And I know like in Malaysia, Sri Lanka, we get like, get to work like more than 24 hours, 36 hours shifts and all. But yeah, here it's not like that. The maximum will be 12-hour shift. Yeah, that's all. So it's good. And the good thing about Australia is you can choose how you want to work. So you can do overtime, you can do weekends, and you can work in rural areas and earn a lot. And if you are if you want like a balanced life, then you can choose to work in a private practice and or like in a hospital, you know, a board-based hospital, and earn maybe a little less. So it's your choice at the end, whether you want to work hard and make more money or work less and be a little bit lazy. So but yeah, so that's the good thing about Australia, is you have options, so you can choose what you want to do. So yeah. And what was the third part? Is that
Expenses and salary.
yeah, okay, yep. So for the exam itself, for part 1 plus registration can cost you around 5,000 Australian dollars. For part 2, it can, if you are taking up coaching classes, it can cost you around 10,000 Australian dollars plus. And then plus the flight ticket, accommodation, you know, like, you know, so and then cost of living here is like reasonable. You yeah, so you earn, and then you get like, it's not it's okay, it's manageable. It's just that the rent can be a little high in Sydney, but otherwise it's good. And yeah, the salary wise, yeah, so again, as I told you, it depends on what sort of work you choose to do. So at the beginning stage, when you start as a resident in Australia, you can earn around $6,000 per month. That is with tax. If you without tax, you can earn around $4,000 per month. So that will be the starting salary. Yeah.
All right. That's another question. Under general registration, what did you mean by supervised practice? Is it in Australia or in the board certified country?
No, so I'll go to that slide. Oh, sorry. I'm not able to move this. Just give me a second. So yeah, so this I think you're asking about this part that I require to undertake a period of supervised practice. That is in Australia. So until you get your general registration, you will be supervised by your specialist, or you know, like a senior registrar or someone. So that is what I meant by supervised practice. So you need to work in medical, surgical, and emergency department, and you need to and your supervisor need to submit a report for your general registration. So yeah, that's what I meant.
Okay, now moving on to the next question. Okay, good evening, doctor. I was wondering generally, what are some of the greatest challenges you have faced as a student or medical officer or while practicing? And do you have any advice or anything to look out for anyone that is just starting on the medical pathway?
Greatest challenge I would say is, first thing was you know, applying for jobs. So I kind of even though I got job in 3-4 months, that was quite frustrating when you apply for around 100 jobs and you get like a, you know, a negative outcome, and so yeah, so that was difficult that time. But you know, the important part is you shouldn't lose hope. You should keep trying, and at some point you will get a job. So that is the challenge. And the second thing is changing yourself, according to this, practice here. So especially when I prepared for AMC Part 2, I used to be a very shy, quiet, not very outspoken introvert person, but in the exams you have to show yourself as a confident, very well, how do I say? Yeah, you should show that you are very competent and you can work in Australia. So and also they expect you to show empathy, be a little bit dramatic in the exam. So that was a bit challenging to adapt that format, but then you will get used to it, because now I feel like that is how we really work here. So yeah, so it's just, it was a little bit weird when we start practicing that way, and now we got used to it. So yeah, but otherwise there is no major challenge. You might not like, so if you might not be able to get a job where you, in the location that you like to work. So I think it's better if you can apply for jobs. So getting the first job is the hardest. Once you have your first job, the subsequent job's going to be easy. So wherever you get your job first, take it up and work there. And then once you get your general registration, you can move to other places. So yeah, that will be my advice.
Okay, thank you so much, Doctor. There's one more question from the chat box.
Yep.
It says, good evening, Doctor. What are the general pass rates for both MC examination, and how would rate the difficulty of the MC examination to you as an MMMC alumni? Does being an MMMC student compared to other medical school graduate give you an upper hand in the preparing for the examination, or do you believe it is the same as the other student from other medical school? Thank you, Doctor.
Okay, so passing rate for AMC 1, it basically depends on the exam. So they do some sort of calculation. They will mark all the candidates in that day, and they will do a graph, and they basically pass 50%, I think, like 50-50. So so it depends on the day. So it's hard to say this is the pass mark. There is no pass marks. It's just, yeah, it depends on the other candidates as well. And the AMC Part 2, so out of 16 stations, you need to pass 12 stations. So yeah, so that's the pass mark for AMC Part 2. If I think as an MMMC graduate, I think we get a very good foundation. We get a very good, our basics are very strong. We get a very good teaching from MMMC. So it was not too hard for us to prepare for the exam. It's not only me, even for the other MMMC graduate, we all felt the same. We all passed AMC 1 and 2 in one attempt, or at least 2 attempts. So it is, it's quite doable. You have to prepare for the exam. You definitely need to study, you need to prepare, but it is, I think because we have a very strong basement, it's very easy to build the knowledge. Yeah, so the only time I could compare myself to other university students was when I attended the coaching class for AMC 2. And then I think, again, our standards were pretty good. It's a bit unfair for me to judge as well, just because we all were at our different stages of career. So when I did the exam, I was in a very early stage of my career with I was kind of like fresh graduate. At the same time, I didn't have much working experience, and there were other students who already specialists and who had working experience, but then they almost forgot their medicine. Like, for example, like, orthopedician, it's hard for him to answer a question on ophthalmology or ENT after 10 years. So it's, yeah, so it's, I can't really compare much, but I think overall, as an MMMC graduate, I didn't struggle much with AMC exams, and even ERPM Sri Lankan exams, if there is any Sri Lankans here. So yeah, so it's quite good. Yeah.
All right, thank you, Doctor.
Okay, thank you,
And there's
Doctor.
another question. Good evening, Doctor. Since we can start working in Australia after completing AMC Part 1, for how long is the limited registration valid till we complete the AMC Part 2?
If I'm not mistaken, it's 4 years. I would just double check the website. I think it's in the AMC website, but yeah, from my memory, it's 4 years. And I know there was a few people who couldn't pass even after 4 years, and they managed to apply for some extension for a couple of months. But yeah, so you should complete your AMC2 within 4 years, which you will.
Okay, that's another question. If I wish to take up a specialty exam in Australia, it says that I have to do 2 years of internship in Australia. So does this 2 years of internship means I have to take AMC for it?
What is MC? MC? Is that medical college? AMC, is it?
AMC.
Oh, AMC. Yeah. So, if we go back, so are you planning to start your specialization in Australia? Or you just want to do the just a few years in Australia? So if you are looking at this slide here, if the last part is the short-term training in a medical specialty pathway, that means that you are already in the specialist pathway in your country, and then you are getting trained in Australia for around 24 months or 1 year to 2 years. So for that pathway, you don't need to do the AMC exam. You just finish your training and then you have to go back to Australia. But in case if you decide to come here and start your specialist training from the beginning, then yes, you need your AMC. And even in case if you decide to start with short-term training medical pathway and then you decide to stay here, then you will switch to a standard pathway, and then again you need your AMC. So yeah.
Okay, so next question, are there any institutions that can provide help in preparing us for AMC exams?
Yes, so that is the coaching classes I was discussing earlier. Let me go to that slide. Sorry. So AMC 1, so there are like coaching classes available for AMC 1 and AMC 2. As I mentioned before, you can join coaching classes for AMC 1, but I don't think it is really necessary because it's mostly theory and you can study by yourself. And for AMC 2, there are like coaching classes such as HEAL, IMG SOS, AMRC. These are the famous one, but I'm sure there are a few more. I did my coaching in HEAL, which was face-to-face, but I know IMG SOS offers online coaching as well. So in case if you decided to get coaching from Malaysia, you can try IMG SOS. It could be a little expensive, but yeah, that is an option. And again, AMRC is face-to-face. So yeah, and yeah, AMC 1, they all provide coaching classes for AMC 1 as well. Yeah.
Right. And what are the requirements to work as a doctor in Australia?
Yeah, so you need 3 things to work as a doctor in Australia. One is an internship from another country, at least 1 year. And then you need your AMC Part 1. it is better if you have both, but yeah, MC Part 1 is a mandatory requirement, and then English language proficiency. So yeah, that's all. That's the 3 things you need.
Next question. Is there any difference in opportunities working in rural areas or urban areas of Australia?
Yes, so in Australia, we divide into 3 categories. Metro, that is the urban area, regional and rural. So rural area doesn't really have big hospitals. It is basically based on GP clinics, a bit of advanced GP clinic, and they transfer the patients to regional hospitals if there is a need. So regional hospital and metro hospitals, if we compare both of them, definitely you have more opportunities in regional hospitals, but that doesn't mean that you shouldn't apply for metro hospitals as well, because I think they need doctors everywhere. So it's better if you apply for both and take up the first job you get. Yeah, but yeah, definitely there are more opportunities in regional Australia. I started my career in Bundaberg, that's the regional hospital.
Right. And what are the areas of specialization in demand currently in Australia?
So emergency, internal medicine, that's the commonest, pediatrics and psychiatry for a certain extent. Surgical specialties and gynecology and obstetrics is quite competitive. So even the local graduates, there are many people who quit because they can't get in, they can't complete the training. So yeah, so it is it's not impossible. There are a lot of there are a few INGs who successfully completed, so it just depends on you as well. So yeah, if you really want it, you can do it. Yeah.
Okay. The next question is the process of getting there the same for dentists?
Dentist, I think dental process is a little bit more complex. To work here, you need to have a registration as a dentist in some other country, but I don't know much about dentist pathway. So yeah, but yeah, that one I know for sure, and it could be a little bit complex. But yeah, yeah, I don't know any other details. I'm sorry.
Yeah, okay, it's okay. Thank you. Is the process same for New Zealand?
Sorry, I didn't hear that.
Is the process same for New Zealand?
New Zealand. Again, I'm not sure. I have no idea about New Zealand. Yeah, New Zealand training, the medical council. Yeah, so I can't answer this question. I'm sorry.
Okay, doctor. Okay, the next question asking about how is the healthcare system in Australia?
Healthcare system is good. It is free for Australian citizens and permanent residents in public hospitals. You can go to private hospitals and private clinics as well. General practice, like a GP clinic, is Medicare. So again, it's mostly free. If you are not a PR or not a citizen, then it's advisable to have an medical insurance, so that they will pay. If you, if not, it can be really expensive. So yeah, and then the other other than that, the healthcare system, yeah, it's good in a way that yeah, you can give it's good for the patients. They are getting a very good standard of treatment here. So yeah, it's good.
Thank you, doctor. There's someone asking, let's say if we fail for the MC Part 1 exam, can we retake the MC Part 1 exam?
Yes, you can retake the AMC Part 1 as many times as you like, but then you have to pay for the exams each time, that's all. Yeah, so you can, yeah, same with AMC too.
Oh, okay. Thank you, doctor. And then someone also asking how to apply for PR and also how long can we get the PR?
Okay, so if you look at this visa option, so if you are migrating to Australia in skill migration, if I'm not mistaken, you will get the PR immediately, or at least in a couple of years. And if you are coming here with a job, then it depends on the contract with the employer as well. Usually the employer helps with PR, and then also there are a few points system that you need to have to apply for PR. Usually doctors get a good points just because their degree carries a lot of points value. So how many years does it take? I see, because I came in a different pathway. I came here in a partner visa, so my process is completely different. It took off like I came here with the PR, and then in around 4 years I got my citizenship. I am not very sure, but if I can recall my friends they got PR in around 4 years, 3-4 years. Yeah. So I think that's the average time. And they came here in option 1, like they got the job here, came here, and then they got the general registration, then applied for PR. Yep. So that took around 3 to 4 years for them.
Okay, thank you, doctor. One more question. I want to ask, just now you said you apply the job, 100 plus job, and then you get the within 3 to 4 months. So when you're applying the job, is it you apply directly from the hospital or from the Australia Medical Council?
So I applied through these links. So see, if you are applying for New South Wales job, so there is no agents. Unfortunately, there is no agencies or anything who can help IMGs in their first job. So you have a lot of agencies now. Like once you have the general registration, it's a lot easy to get a job. But as an IMG, getting a first job can be really challenging. And I basically go through all these websites, and wherever, there is a vacancy, I just apply. Initially, I kind of, applied for jobs that is even like, I don't even like some, because they have different terms like resident, junior medical officer, like a locum, things like that. So I basically applied for everything. But yeah, so that's how you need to apply for jobs. And there is another little trick I would like to share with you all. So as I told, it could be really challenging to find a job in Australia. There is a little alternative option that you could probably, if you are interested, you can do the PLAB exam and go to UK first, get the registration there, and then come to Australia through this competent authority pathway. I have one of my, so this first competent authority pathway. So you are eligible for this pathway when you have a UK registration, or Canada, USA, New Zealand. So compared to all these countries, UK registration is something which is easy to get. So if you can do PLAB, go to UK first, get registered there, and then you can move to Australia. So that is an alternative option if you can consider. And I heard that PLAB exam is relatively easy compared to AMC, and also there are more job opportunities in UK at this present state. Yeah.
Okay, thank you, Doctor. There's one more question again from the participants. I think she said about good evening, doctor. How much is the salary and how is the housing cost? etc. roughly.
Yeah, so salary, when you begin as a resident here, you will earn around, average 6,000 Australian dollars per month with tax. So without tax, you can earn around $4,000. But then with the rent, housing cost depends on where you live. So if you live in Sydney, if you are working in Sydney, the rent is really high. It can cost around, see, if you're not, usually people share because it can cost really a lot. It can cost around $1,000 every week. And usually doctors, they share the accommodation. And if you live in a rural or regional area, then it's quite cheap. It will cost around maybe $500 a month or maximum $1,000 a month. And the salary wise, it depends on how you want to work. So yeah, I did talk about it before. So yeah. Nice.
Right. So I think that will be our final questions for today.
Okay.
All right. Thank you, Doctor.
Thank you. Yeah.
Once again, I'd like to pass the floor to Teresa, the organizing chairperson, to give some speech.
Okay, thank you so much, Pang. Hello everyone. I'm Tricia from Batch 44. I'm very honored to be the organizing chairperson for today's event. And first, I would like to thank our speaker for today's, Dr. Dularaga, to joining us. And we are very honored to have you with us today to share more about the pathway and also the experience in working in Australia. We really appreciate your hard work in preparing for today's event and answering our question. And beside that, I also would like to thank our advisor, Prof. Som, and also our chairman of AMSA, Wen Hao. So that's all from me. Once again, thank you, Dr. Dularaga, for your time and effort to deliver the webinar today. Now I would like to pass the floor to Pang, the MC, to conclude the last part of the events.
And I'd like to thank you all for your time and attention, and good luck, everyone. Yeah.
All right. Thank you, Doctor. All right. Thank you, Tricia. Now we have come to the end of the session. So to all the participants, before you leave, please spend a minute to answer the feedback from the link in the chat box, as it will help us to conduct better webinars in future. And please do reach out to us if you have any feedbacks or comments. We are reachable via Instagram, AMSA MUCM, as we post updates or our upcoming events there. So yeah, thank you everyone, and hope to see you in the next event. Thank you, Doctor.
Thank you. Bye.
Thank you so much, Doctor.
Thank you. Thanks for organizing. Thanks.
We really get a lot from this.
Oh yeah.
Thank you.
Hope it was useful. That's good.
Thank you,
Yeah,
Doctor.
it's
All the best
useful.
for your exam.
Thank you. Thanks. Wish you the same. Yeah.
Okay, I think participants can leave now.